بسم الله الرحمن الرحيم الحمد لله رب العالمين الرحمن الرحيم مالك يوم الدين إياك نعبد وإياك نستعين اهدنا الصراط المستقيم صراط الذين أنعمت عليهم غير المكتوب عليهم ولا الضالين آمين.
Thank you. Assalamu alaikum wa rahmatullahi wa barakatuh, everyone. Thank you for joining us today here at Micah, Nigeria. So a little bit about us. Our vision is to see Muslims return to the state of Islamic excellence. Our programs include feeding the soul, creating a safe space, economic development, leadership and competency, capacity building, encouraging positive social interaction, and promoting a passion for the deen. You can become a member of Micah Nigeria by completing a membership form, which we will share with you in the chat box. And we also encourage you to subscribe to our YouTube channel, which is at Micah Nigeria, one word, and then space Lagos. So on our YouTube channel, you can find recordings for previous events. And for more information, please just use the chat box to communicate with us. For those of you who are social media savvy, we also have an Instagram page, Micah Nigeria, and we have a website, micahnigeria.org. So we encourage you to check those out as well. So throughout the course of today's lecture, questions will be taken from the chat box. And because of time, I advise that the sooner you put your questions in the chat box, the sooner they'll be dealt with. From last week, I could tell that this topic is very popular, this topic on infertility. And so we should make use of our brilliant doctor in the house and ensure that we keep her busy with very interesting questions. So just as a reminder, for those of you who weren't here last week, the topic of today's talk is Road to Parenthood, how to deal with the struggles of infertility. And this is a two-part session. So we had the first session last week, so you can check out the recording online. And our speaker is Dr. Rabiu. So I'll just read her bio again. She's an obstetrician gynecologist. She bagged an OND in science laboratory technology from the Polytechnic of Ibadan. In her quest for more knowledge, she went further to the prestigious University of Ibadan, where she obtained an MBBS in medicine. She also obtained an MBA from the Metropolitan School of Business in London and a certificate in assisted reproduction in University College London. She has a special passion and interest in preventive medicine and assisted reproductive technology. Also worthy of note is the fact that she is the medical director of Shifa Medical Center in the heart of Ikorodu. She is also a blogger on Ask Dr. Fab page, so make sure you check out that page. So I'll hand over to you, Dr. Rabiu.
Thank you, Mariam. It's good to see everybody again. May Allah continue to preserve us upon high. How are you all and how's your weekend? Yeah, thanks for joining last week. For those joining in today, I hope you have a fruitful time. We had some pending questions. We know what the topic is, Road to Parenthood, the struggles, dealing with the struggles of infertility and the challenges. But before we make the concluding part today, I'd like to touch the three pending questions. One of it is, how much is IVF? IVF, for a lot of us that don't know the full meaning, is in vitro fertilization, okay? It's about getting the sperm of the man, getting the eggs or the follicles of the woman, the eggs, mixing it together and forming a zygote, a baby. So usually it's variegated. Unfortunately, our government hospitals, the public hospitals that are supposed to give cheaper or subsidized prices don't have enough gadgets for IVF. So most of the IVF centers we have are actually private owned. So if I tell you this specific amount, you can get to IVF center A and it is 1.5 million. You can get to IVF center B, it is 2 million. Then each of the cases is individualized. If it is the husband's sperm, if it's the wife's sperm, is usually cheaper. I mean, sorry, if it's the wife's egg, is usually cheaper. If it is donor egg, donor sperm is another package on its own. If the lady has to do some procedure like laparoscopy, or they need to do some minor procedure, there'll be additional charges. So let's just go straight to the point. With 1.5 million, IVF is doable. That's an average. Let me just give average. Then there's a question on anti-sperm antibodies. That's the word we use for it. The Yorubas will call it EDA. Like the woman will come and say, my husband's sperm is just washing away. When we copulate, when we have sex, the sperm is just drifting away like a river. The Yorubas call it EDA. But we just tell our clients, our patients, that there's nothing like that. There are like 20 to 200 million sperms. Just one of it is enough to fertilize the egg of the woman. And again, when you put a cup erect and you put water inside it, it won't pour. But when you put it upside down, of course it will pour. But nature or God has made it in such a way that the one that will swim up, that has the good motility, that has the good structure that I explained to us last week, will still move up. So if the woman is saying is washing away, it is just a psychology that is making her think like that. That's why some women after sex, some of them will try and put themselves upside down for like 10 minutes. All those things, that's a specific issue. Yeah, the third question is about how do we detect congenital abnormalities in the unborn child, in the baby? Now, there are several tests. If the person is actually doing IVF, there is the privilege that they can actually screen the embryo before transferring it to the womb of the woman. We call it pre-implantation genetic screening. That's the way I can coin it for us. Before they put the baby inside the womb, or the embryo inside the womb, they will screen it. Oh, if the mother is AS, if the father is AS, they want to make sure they are not transferring a sickler. If the father is somebody that has congenital diseases such as immotile celiac, there are so many diseases that runs in family. So if a particular couple, the husband and the wife, has any of those, they will screen. That is the same screen they actually do too, to check if it's a boy or it's a girl. Because we actually have couples that are saying, no, they want a girl, they want a boy. That one is another day's topic. So the best way, if it is IVF, they will do a pre-implantation genetic screening, okay? Now, if it is natural conception, the woman is already pregnant. There are some tests we can do in the first trimester. First trimester means the first 3 months of pregnancy. There are some we can do in the next 3 months of pregnancy. That's the second trimester. And there are some that we can do in the third trimester, the last 3 months of pregnancy. But again, the best thing is to actually screen those things in the first trimester, because the question still arises. That's another talk for another day. Oh, at the first 3 months, you now find out there's an abnormality in the baby. Are you going to wash away the baby? Is that what we call therapeutic abortion? That, oh, this baby, it has been found that this baby is likely to have Down syndrome. This baby is a sickler. This baby has there are so many, has Edward syndrome, has Patau syndrome. Do we wash this baby away? So there are so many questions on it that, okay, Islamically, if it's therapeutic, you can wash it away. So if you now wait for 6 months, or you wait for third trimester to screen, is that the time you now want to decide to do what we call, don't let me use the word, we call it fetal selection, like, okay, this baby, you don't want it, you want to wash it away. So there are tests. Those tests, some of them are expensive, I must say that, but there are tests to screen. And usually the indication for screening includes things like the woman is above 35, the woman or the man has certain congenital anomalies that have been seen in the family, or the woman has even given birth to a child that has hole in the heart, or a child that has Down syndrome before, or a child that has some form of congenital anomalies. So there are indications. Then there's what we call fetal anomaly scan that we do from 18 weeks, when the woman is 18 weeks pregnant and above, that we can actually detect some of these things. Mariam, so those are the questions unanswered. Now, let's go to the concluding part of the challenges, the struggles. We have defined all what infertility is. One of the very basic, foremost challenges a couple have is the financial challenge. People would rather use money to wear clothes, to buy clothes for themselves, to furnish their houses. But when it comes to cases of infertility, they need to spend money on the investigations, on the consultations. And I tell you, it is purse draining. It is wallet draining. And of course, they don't have a choice. Part of this financial challenge includes things like even the husband needs to follow the woman to antenatal, to the gynae clinic, sorry. The woman, if she's a working class woman too, she needs to take excuse from her employer. The man, if he's an entrepreneur, the time that he has followed her to the clinic, it's accountable too. So the money that is supposed to come in, they'll be deprived of it. The money they have that, okay, maybe he's using it for a project, he wants to build his 5-star mansion somewhere, he's going to have to take that money. The money he needs to give his family, maybe his extended family or a family of orientation. So it is financially draining. And it takes a couple to be understanding with themselves. We have seen cases that even the husband will say, so I don't have money again. I gave you 50K last week. The doctor is saying you should do another test. Why didn't they say you should do the test together? And of course, the woman is not using the money to eat pizza, neither is she using it to take ice cream. So it could actually be financially depressing. So one way to go about that, I've mentioned it earlier, is don't let us do doctor shopping. You alone have gone to 10 different doctors. That is like having times 10 the money you are supposed to spend. You understand? Because they will still tell you to repeat all these tests. Do your tests when you are supposed to do. And it's so sad that we don't have non-governmental organizations. There are very few, maybe one or two, that will actually take care of infertility cases. Most of the NGOs, most of the charity organizations we have, they go to orphanages, they go to, we want to go to prison. What is it doing? Nobody talks about, somebody wants 500,000. And in fact, the people that are being classified as infertile, they don't even have the courage to even beg for money. They can't go to the churches, they can't go to the mosques that we are looking for money for IVF. You will even have comments like they will tell the man, go and marry somebody else now if this one cannot get pregnant. So the financial challenge is much. Then dealing with it, like I said, it drains the savings of the couple, the husband, the wife. One of the ways that this can be dealt with is actually the health insurance scheme. But unfortunately, the health insurance scheme does not even take care of in vitro fertilization. Most of them will take care of things like, okay, you have a surgery to do. They say she has fibroid, they need to get the fibroid removed. There are some basic investigations. But when it comes to the money, the cycle, the fee for the cycle, the fee for the drugs, most health insurance schemes will not cover it. So even if you are going to say one of the ways of dealing with the struggle is to enroll in an health insurance scheme, maybe 1 or 2 out of 10 health insurance as the HMOs will actually offer that kind of help. So it still boils down to the couple trying to sit down with themselves. Okay, this is the money we have. Let us target this year. Our babies are coming this year. We might even start with twins or triplets. Let us focus. But really, it's not easy in this time of economic recession. Now, the other challenge is the social stigma to it. The woman has low esteem. In this part of the world, once a couple is infertile, the first person everybody thinks has problem is the woman, and that's pretty unfair. Like I said, it takes 2 to tango. The sperm must be able to meet the egg for the zygote to be formed for a baby to be born. Okay, but even the women folk themselves always think they are the cause of the problem. I have seen couples or even the woman coming behind the husband and say, doctor, I think I'm the problem. Please treat me. And we insist, no, you need to bring your husband. We need to check his sperm to say, no, doctor, just treat me first. I think I'm the one that has the problem. And at times we end up now checking the husband, and we now find out that the cause of the problem is even a male factor. So the social stigma is a lot. And I don't know how to say this in whoever wears a tight shoe is the one that knows where most the shoe is paining him or her. It is easier said than done. It's easier for us to say, oh, sorry, Allah will provide for you. Oh, sorry, your babies are coming. They have their low times. They just have times that they feel like hibernating. They have times that see if they feel like they should just go away somewhere, nobody should see them. Because even the society is so bad. How are you? When are we coming for your naming ceremony? Or you branch in a shop with your friend and you are picking a sanitary pad and your friend is saying, so you are still buying sanitary pad? I thought you have missed your menses. There are so many comments that people pass around and they don't know that it actually affects the infertile woman or the infertile couple. Or you go to a naming ceremony and all the prayer people are saying there is, oh, God will provide your own for you. As I have come to do this on today, we'll come and do your own next. Of course, the couple will smile, but deep down, they will get home and they still think about it. So one of the ways we can even help these people is to downplay some of these things. I know of a patient that she says that in the morning she goes out, that's the prayer everybody tells her. She goes to buy pepper in the market. The woman selling pepper will tell her, sorry, oh, God will provide for you. You know, it's not like, I don't even want to see anybody. I don't want anybody to tell me anything this time around. So the stigma is so much that it gives the couple low self-esteem. And like I said, it's the woman that is usually affected. The woman feels she's a loser. I've seen patients praying that, God, even if it's just 1 month, let me miss my menses. I don't even care if the baby didn't stay with me for 9 months. Let the whole world know that, okay, I missed my menses. I got pregnant. I want to share a pregnancy test strip that is showing 2 lines that is positive. Let me rejoice and let people say, congratulations. They pray so hard that at times they even say rubbish during their prayers because they've been affected so much. They feel they are just losers. Sometimes they feel, oh God, what offense have I committed? What did I do when I was small? I didn't do abortion. I have friends that have done 10 abortions. And yet, immediately they got married, they got pregnant. I have been a virgin. I've been a very good girl. I have not been a bad girl, and yet you are not giving me a baby. God, who have I offended? Or people start thinking, oh, there's somebody in their village. The last time we went to greet them, that person was looking at me somehow, or that person used handkerchief to rub my. I've seen people say during their wedding, somebody came and used handkerchief to rub her tummy, her abdomen. So the thing affects, I will still get to the to the one of emotional instability. So the low self-esteem is much. People will start calling her a barren. She herself, call herself a barren. I told you, it's the woman that's usually affected. The confidence is gone. Even, men, I need to say this, they have their ego. They won't let it show that they are pained. They attend naming ceremonies too. People pray for them. They will say, yes, they will show big guy outside. But in the confines of their room, they too, they think about it. And why am I shooting blanks all this while? After all, when I was in university, I impregnated 2 girls now, even though I told them to abort. But those ones, they can't discuss with anybody. In their own innermost mind, they'll be like, but I'm okay now. What's wrong with me? So that thing causes a lot of low self-confidence, okay? The doing things that the way we can now sort of approach this when it comes to the social stigma is you just need to ignore some of these comments. I must say that it is easier said than done, because even if you don't want to hear these comments, you will hear it on TV. Some people will talk about it. You go on the street, you talk about it. The people will talk about it in the offices. You hear, oh, somebody gave birth. You will hear, oh, we are going to somebody's naming ceremony. So, but do things that will make you happy. We know of the stories of some of the prophets that never even had a child. We know of some that had children in their old age. So building your self-confidence is very important, because after all, even when your children come, you still need to be alive and be happy to be able to nurture them. But if your self-esteem, your confidence has gone, then you yourself, you are just a walking corpse. So you ignore comments, do things that make you happy. There are options. We'll get to that side. I mean, to that talk. Now, another challenge is the matrimonial discord. You know, some of these things, they like enter themselves. You know, there is a continuum. You know, you are not happy. There's a social stigma. Your savings are gone. You have spent the whole of the money you have in your life, and yet you are not achieving results. A time will come, will be like, what are we even doing? Maybe God, maybe our destiny is not matching. That's the way some couples say it. Maybe our destiny is not synchronizing. Maybe everybody should go their ways. Okay? There will be lack of communication. Okay, you've been having sex. They say we should have it 3 times a week, at least 3 times a week. And yes, you've been having it 10 times a week and nothing is happening. The man is feeling he's been playing football and is not scoring any goal. The lady has been so submissive, she's really praying. Even during the sex, instead of them to try and enjoy it, they're like, oh, do it well, let this baby come, you know. All those things actually causes a lot of discord. So the couple will end up having lack of communication. You know, though they are not happy, it's more like even the marriage is just for procreation. The companionship parts will be depleted. The fact that, okay, I need somebody to talk to, somebody to lay my head on, is no more there. There'll be transferred aggression, you know. At times, the husband might even comment when maybe the wife says, oh, my menses have started. He can even comment rudely, which menses gone, say, what's your problem? You know, at times it's a reflex thing. Or the man is so angry that I'm tired of buying sanitary pads for you. Please use your money to buy sanitary pads. So it causes a lot of matrimonial discord. Then one of the ways this can be addressed, I know it's not easy. At times it's so bad that we need to involve clerics, imams, pastors to intervene. It's that bad at times. It's on both sides. The lady herself is tired, the husband is tired, and they're like, is there a midway at all? Maybe everybody should just part ways. Again, one of the ways of combating this matrimonial discord is communication. I mentioned last week that we should not allow a third party to ruin things. The third party, like I said, can be from any angle. It is very important that the couple stay together through thick and thin. So one of the ways is, okay, let them attend clinics together, because the body is usually on the woman. Once the man drops money, it's the woman that goes to clinic from 8 a.m. and can't come back until 4 p.m. She's tired, she needs to get home and cook. At the end of the day, there is no good news she had from the hospital. They are saying, oh, she can't bear a child, her tubes are blocked, she has to do IVF. She's coming to tell the husband that they say it's only IVF I can do. So there's a lot of issues. So communication is very important. Counselors too. We need mental health therapists at times, usually for the lady. The man is not exempted too. Psychologists can be included. Gynecologists, urologists, endocrinologists. The man has diabetes. He's having issues with his sperm. The woman has diabetes, or she has some autoimmune disorders. We call some SLE. That the woman will just be having miscarriages. You know, there are some women like that. They've had like 10 miscarriages, no baby. So all those things, the way all these things can be addressed, attacking or combating these challenges, is to synchronize all these things together. The medical personnel, the couple communicating, and if need be, clerics helping them at least to sort out issues. Also, part of this thing is that you must not patronize quacks. I said it earlier. Some will go and spend a lot of money. They'll say, oh, you have fibroids, you are going to excrete it, or you are going to defecate it. You would have used money unnecessarily, and at the end of the day, you are back to square one. Also, herbal concussions, let's be careful. Most people deal with all those things they call agbo, but we need to be careful. If you're on certain drugs, your doctor has given you certain drugs, you need to be careful, because there can be cross reaction. So my advice, part of the way of combating this is, if you are seeing your doctor and you have been given some drugs, hormonals, injections, drugs, don't mix it with herbal concussions. Leave your herbal concussions for a while till your doctor is through the treatment is offering you. Then there are so many scammers. I need to mention this. Everywhere, Instagram, Facebook, anywhere, everywhere on the internet. Oh, this is what I took. I've been looking for babies. I've been trying to get pregnant for the past 5 years, and they gave me this thing. And link in the bio, WhatsApp this number, and that's how you enter one chance. They will tell you, oh, this concoction, once you take it, give it to your husband, you get pregnant. You come back, they'll tell you, oh, you've not bought enough supply. Buy more. You have to take it for like 6 months. The other person took it for 8 months before she got pregnant. And that's how you be good. And at the end of the day, you still go back to square one to come back to your doctors. Yeah, family, in-law, third-party influence is part of the things that can actually cause a lot of trouble. There can be ill influence. We've seen cases whereby the mother will just go to the village and go and bring another lady for the man and just say, oh, this one is fertile. Please, I don't know. Just marry her, just impregnate her. And we've seen men go to the back, impregnate another woman without the knowledge of the woman, of the wife. You know, so many things happen. We know all these things. Then, of course, there is driven love between the couple. Of course, love brought them together, but when there are problems, things start to wane. And it takes the grace of God for things to come back to normal. There's lots of libido. The man is not even ready to do anything again. He's tired. The woman too is tired. Or they'll just limit it to when she's having ovulation and she's saying, oh yeah, I'm ovulating. So sex will not even be something they want to enjoy anymore. They are just doing it because of conception. And all those things will actually cause lack of interest. And the man will be feeling as if he's actually a leper. The woman herself will be feeling, oh God, please protect us, give us this. And at the end of the day, even the things that are supposed to make you so happy will no longer be there. Mood swings. You just see a woman just shout anyhow in the market. Maybe somebody said, oh, you have change to collect, and the next thing she's shouting like somebody that dog bites or something. You know, there are usually these up and low moods. And at times the woman, most times she's not in control of it. At times it could be so bad that there could actually be suicidal attempts. Okay, depression, all those things that are emotional challenges. And all this will cause an emotional imbalance. And one of the ways of tackling it, like I said earlier, is consulting a mental health therapist or consulting a psychologist as the need be. So basically, I just need to paraphrase and summarize all those challenges as a whole for us to know these challenges are real. And let me mention that there are some challenges that cannot even be said out. We've seen cases that the husband probably doesn't have sperm. The wife knows, the husband now knows, and we don't know what way forward. Because in our religion, you can't do donor sperm, you can't do donor egg. So what happens? Do the couple part ways, or will they just do adoption? You understand? And then some scholars have said that, okay, if it's a case of polygamy and there are co-wives, if the woman is the one that has issues with her eggs, she can actually use the eggs of her co-wife. That one is allowed, since those other wives or the other co-wife is legal to the husband. But there are different schools of thoughts on this. So these are the basic challenges. And maybe by the time questions are coming in, we'll be able to rattle more. Thank you.
Thank
Maria.
you. Thank you, Dr. Rabiu. I wanted to take the questions in order, but I'm going to take the one that came in last because it's related to some of your concluding points. So the first one, which I think you answered, is it allowed to do trans sperm? Is IVF the last?
Is it allowed to
do trans sperm? I think that's sperm donor, trans sperm. That's how the person phrased it. Is it allowed to do trans sperm? Is IVF the last hope of infertility solution? So is IVF the last hope for someone who's infertile? And what is the rate of its efficacy? So that's one question. Well, one person's questions. Do you want me to read all the questions out?
Thank you.
Okay. All right, cool.
Let me be taking like in twins or like 2 or 3. It's better that way. Thank you. Sperm donor. I'm not a scholar. We have so many scholars in the house. But so far, the consensus on sperm donation in Islam is that it is not allowed. it's likened to that person is not legal to you. So why would you collect somebody else's sperm? Is the scholars have likened it to a form of zina, either fornication or adultery. So, like I said, some of these things are some are very hard knocks to crack. Okay, the man doesn't have sperm. Okay, even if he leaves this woman, if this woman leaves him or they depart, the problem still arises is still with the man. He doesn't have his sperm. Oh, so what will happen? He will just be there and not get married. Now, when it comes to sperm issues, it's different from when the man has erectile dysfunction. Islamically, if a man knows he's impotent, nikah, wedding, marriage is even forbidden to him. That's another day's talk on its own. So to answer the question directly, on a direct claim, sperm donation is not allowed in Islam. And same applies to egg donation. Sperm is the reproductive gamete, as in the reproductive cell of the man, while the egg, we call it ova, egg, is that of the woman. So egg donation, sperm donation is not allowed in Islam. Now, mark my words, we all know it is not allowed, but in the real sense of it, we see that people do it. I'm talking about Muslims do it. But at times, things are just between you and your God. Ours is not to judge, because when it comes to your turn, you really know what is going on. So, but sperm donation is haram, egg donation is haram. The second question is in vitro fertilization the last hope? IVF is not the last hope. Always mark my words. I said when an infertile couple goes to the gynecologist, it is when they've done all things. They've checked what is wrong with the man. They've checked what is wrong with the woman. That is when they can now prefer the particular fertility treatment for the couple. Now, at times, the male can be the problem, male factor. The female can be the problem. Or in so many cases, there could be a combination of the two. So both male and female factor. Meanwhile, I told you there is a causative factor that we call unexplained. We've checked the man, we've checked the woman. We cannot even find any reason. So we don't even have explanation for their own infertility. So we have what we call indications for IVF. There are reasons why some people, for instance, a woman that has blocked tubes. I showed you the diagram of the female reproductive anatomy. Her tubes, both tubes are blocked. There's no way she can achieve natural conception. Let her continue to pray from today till heaven comes. Okay? The solution to that is IVF. Cases like endometriosis in a woman, the solution to that is IVF. For some women that have fibroids, if they remove their fibroids, they can get lucky afterwards. So IVF is not the only solution, but usually when we have people that have been investigated and we know that the only cause, the reason for their infertility, the solution to it is IVF, we offer them. There are other things before the woman can get pregnant. Though it's not sperm abnormalities in men. So when we even have a very bad sperm analysis in a man and the woman too has issues, at times we can actually tell them IVF is their better option or their best option, but it's not the last hope. There's even adoption, but a lot of us are not so conversant with it in this part of the world. Then somebody asks, what's the success rate? You see, even natural conception, the man meets the woman, okay? They meet themselves. The percentage success or the what we call fertility rate is not more than 30% naturally. So even for IVF that we are using technology to achieve conception, usually is not more than 20-25%. So we have a lot of clients, we have a lot of patients. Once they come to your IVF center, the first question they're asking is, what's my success rate? Some want you to lie to them that, oh, the success rate is 30%. Or some will tell you, in our centers, all our IVFs have always been successful. We've never had a failure. That's a white lie. You know, there's this thing we call loriro. So success rate of IVF is not more than 25%. And that is why whatever we do, whatever solution we want to opt for, we still need to pray to Allah. One of the ways of dealing with the challenges of infertility is to be close to your God. Because for all that you care, the doctor only cares. It's only God that cures. Mariam, those are the questions.
Thank you.
Yeah.
Let me go back to the top. So, is it halal to? The term is to wash a baby away, but I think obviously to abort.
I didn't get you.
Is it halal to
Yeah.
abort a baby if abnormalities are detected?
Is he allowed to abort?
Wash a baby away. I wasn't comfortable with that, but yeah, that's how it was phrased. Yeah.
Okay. Now here we go again. When it comes to issues of abortions, we have rulings on it. We know abortion is not allowed, even in the country, and it's not allowed in Islam. But a caveat to it is when it is therapeutic, when the continued existence of that baby is going to threaten the life of the woman carrying the baby. Let me repeat myself. Abortion is not legal, it's not legalized in our country. Abortion is not allowed in Islam. However, when there are rules, there are exceptions to rules. Medically, when abortion is needed for a woman, is therapeutic in the sense that if that baby continues to live in the womb of that woman, then that woman can die. That is one of the reasons why we can actually abort a child for a woman medically. There are cases, but I don't want to go into that because that would be so medical. Now, Islamically too, if the baby too is going to threaten the life of the woman might even have other children, so she needs to be alive to actually take care of her children. However, even though there's an exception to this rule, a lot of people have misused or they have abused it, They've abused that privilege of, some will quote that, they said if it's not up to 12 weeks, is it 12 weeks or 40 days? There's a ruling about that, okay, the spirit has not been breathed into the baby, so you can still abort. But they've forgotten the fact that there's an exception that you just don't do abortion. Now, the question now arises, we have done the test I said we should do in first trimester, and we have found out that this baby is not compatible with life. That one is not debatable. We have people that have faith that, okay, we've even told them that the baby does not have head, but they say no, they want to give birth to the baby. We have people with such beliefs that, your baby doesn't have head though. No, don't abort it though. I will bear the child like that. And you bear a child, it can even cause psychological trauma. So when we have babies, when we have fetuses, we call it fetus when it has not been born inside the womb, that have congenital anomalies that are incompatible with life. What I mean is that they cannot survive at all. It will even be more trauma for the woman. Then we can do what we call therapeutic abortion. But that will be with the woman's consent. It's not just for you as the doctor to say, that's what we offer you. You cancel her, and if she's okay with it, and the husband and wife, you go ahead. So that answers the question. But Islamically, it is not allowed. The only time, the exception to the rule is when it threatens the life of the woman, and it is usually when it is even done within the 12 weeks of pregnancy. Allahu Alam.
Thank you. Next question. Are there some medical conditions that single unmarried women should be worried about that may cause infertility in the future?
Okay, thank you very much. Are there medical conditions that singles or married couples should be worried about? There are a lot, actually. Along the course of my discussion, I mentioned that at times, even when a woman is diabetic, when a man is hypertensive or diabetic, or when the woman is hypertensive or diabetic, they could actually have issues getting pregnant. For instance, a man that is on some antihypertensive drugs, there are some of these drugs that actually cause a lot of, what will I say it? There are some of these drugs that some of the side effects is erectile dysfunction. The man is not able to come up. And so he's even going to have issues having ejaculation. So if there's no ejaculation, how would the woman get the sperm to fertilize her eggs? So we have some drugs that even have those side effects. Even diabetes on its own has some complications that actually affect the neurons of the man and can affect his sperm factors. Okay, the woman herself too, she's diabetic, long-standing diabetes that we call chronic diabetes. There are some women is during pregnancy they have diabetes, what we call gestational diabetes. But some women that have long-standing chronic diabetes, they might even be having miscarriages. They are even at the risk of having congenital anomalies, having a baby with big head, having a baby that has skeletal abnormalities and the stuffs. So these conditions are a lot. There are some women that we have some endocrine disorders too, that we call polycystic ovarian syndrome. Some of them have different medical conditions that can actually affect. Now, one of the issues we normally have is this. They are married. Let's talk about the ones that are married. When they are married, they are discovering that they have this issue. So good, they are together. So it's for them to tackle it. The issue we now have is people that are single. Do we go out of our way to do some of these tests for them before they get married? We know there are some basic tests we need to do. If you don't know, we need to know today. Before you get married to anybody, before anybody wants to marry you, you have to do hepatitis B surface screening, hepatitis B surface antigen screening. That's hepatitis B that everybody calls it. We have to do human immunodeficient virus screening. That's HIV screening. You have to do what we call your blood group. You have to do what we call your hemoglobin genotype. Because if you are AS and your intended spouse is AS, you can have a sickler as a child or as children. So we know those things are basic. There are some, again, tests for syphilis. At times, some people do some extra tests. Now, maybe we should even start adding COVID-19 tests to it. That's just a joke. That's not by the way. Now, the question now arises, apart from all these pre-marriage tests, can we actually test the man's sperm before marriage? Let's just even say the man is a virgin. He has not had sex before. Of course, can we collect his sperm and check and be sure before we marry him to Sister Lagbaja? Can we collect the blood sample of Sister Lagbaja and check if her hormone profile is within normal limits? I want to be sure she's pregnant. You know, in this part of the world, I don't want to mention particular tribes, some will insist on their son, but until you make her pregnant, that's when you marry her. I need to be sure she's fertile. You know, somebody married somebody for 10 years and they didn't get pregnant. So it is when this woman is pregnant that you are going to take her to the altar. So can we now say, let's take a woman before she gets married, let's check her. Let me do scan for her. Let me do HSG for her to check if her tubes are open. Let me sure she doesn't have fibroid. Let me be sure that she doesn't have cysts. Is that justified? For the men, can we just collect their sample? So to answer the question, in actual fact, there are tests to do to actually check the reproductive capability of the man and the woman. But are we not going to be shooting ourselves in the legs? Okay, before marriage, they now know the problem. The woman will start hanging. Nobody will come to her. She knows her problems. The man is hanging. So those tests are there. If you want to be sincere with ourselves, I don't think we have anything to lose by doing those tests. Because when we actually know a problem is there, the problem is already half solved. I think that answers that question, Maria.
Thank you very much. There was a question similar to it. I would just ask anyway if you wanted to add anything. So what kind of tests would you advise for a man before marriage so he can be aware?
Okay. Yeah. For the man before marriage, the test he can do. It can actually check its sperm parameters. So I will spell that it's simple. It's a very simple test. It's just that I will tell you the logistics that comes with that test. Now, the test a man can do is what we call SFA. S for snake, F for Fatima, A for apple. SFA, seminal fluid analysis. Okay. Now, in addition to that, they can now do what we call MCS with it. MCS means microscopy, culture, and sensitivity. So SFA, MCS. That MCS part is just to make sure the man doesn't have infection. That's what that one does. And if that man has infection, there will be a particular organism that would have been cultured, and they will tell the man the drug that can work for his infection. Now, but the more important one is that SFA part. It will tell us if his sperms are normal looking. I showed us the structure of a normal sperm. It will tell us if they are moving, if they are very active, if they can move, okay? And it will tell us the count, that how many do we have. Now, the logistics for a man that is not married is that he will not be able to collect that sperm sample via sexual intercourse. In fact, for those that are married too, I mentioned it, that the best sample is actually the masturbative sample. So the one we prefer that will give us better results is the sperm that is collected through masturbation. So the question now arises that why should a man masturbate? Okay, so we've had ethical issues about it. I'm married now, why should I masturbate to get sperm? But we'll now explain to you that, okay, you are not doing your masturbation out of illicit pleasure. You are doing it because that sample is a better sample for us. The one you collect during sexual exposure or during sexual intercourse can be contaminated and won't know the real picture of your sperm. So what now happens to a man that is not married yet, that cannot even collect it through sexual intercourse, and we are insisting that it's through masturbation? So that's the issue we have with that. So it is if the man does sperm analysis and there's an abnormality in his sperm, that we cannot do further tests on the man. Again, there are some men that have issues with the size of their testes, their testicles, those little balls in their scrotal sac. If you are somebody that is worried about that, you don't need to wait for when you are married before you go and see a urologist or a gynecologist, as the case may be, so that they will tell you the size of your testicles are normal. We've had patients that one of the testicles is actually not in the scrotum. One is actually up in the thigh, or one is even in the abdomen, what we call undescended testes. So if a man has that issue, he should actually check himself before marriage. Or if he has issues, let me tell you, as young as a 7-year-old boy, they normally have erection in the morning. For mothers that are on this platform, you just see that we call it totoros of the child is standing. When you are noticing that even your child, as small as he is not having erection, or you are noticing that those little balls, as soon as you give birth to your male child, you need to check, are those testicles there, those little balls, are they inside? For the woman, you need to check the private part. Is everything okay? Does it look okay? Is the vagina opened or is closed or is plastered together? So when we notice all those things, we don't need to wait for when the person marries before we start investigating. So that takes care of that, Maria. Then for the woman, sorry, Mariam, for the woman, she can also do tests. Maybe that man is just asking for himself. The woman too, there are tests that she can do. You just consult your doctor or your gynecologist. Mariam.
Thank you very much, Dr. Rabiu. Could I ask you to repeat the meaning of, I think you mentioned something that was MCS. The person is asking you to repeat the meaning of MCS. Did you mention something, MCS?
Okay. Yeah. N for monkey, okay. C for cat, S for snake. Now the M is microscopy. Microscopy, okay? Microscopy. they are going to put the sperm under a microscope to check if they are microorganisms. Then C is for culture. Culture means they want to know the microorganisms that is in that person's sperm. Then sensitivity has to do with, okay, we have seen the microorganism that is in this man's sperm. We want to know the drug that is sensitive to that particular offending microorganism. So it's usually an antibiotic. At times, some people can, usually some women have what we call yeast, maybe some fungal infection. So MCS, microscopic culture and sensitivity. We normally do it together. Even the women have their own. We have what we call HVS, high vaginal swab for MCS. We have another one we call endocervical swab for MCS. Those things are things we screen for infection. The woman is always having discharges. The man has some funny discharges from his from the opening in his penis. You need to do all those tests to be sure. Okay. All right.
Thank you very, very. Two more questions before we close, inshallah. So one of them is surrogacy allowed in Islam? Is surrogacy allowed in Islam? And then the second one is endometriosis the same as fibroid?
Okay, thank you very much. I'm really happy with all these questions. Yeah, Bismillah. Surrogacy in Islam is an English word, but let me expatiate a little bit. Surrogacy has to do with a woman helping an infertile woman to carry a baby. I just need to use those simple words. Okay, this woman is having issues getting pregnant. They found out that maybe her womb cannot accommodate a baby, cannot implant. I don't know, I need to use simple words, okay? So she's having issues with her womb, but her eggs are fine. Her eggs are fine. And the sperm of her husband, the sperm is fine too. So they can actually use the sperm of the husband and the egg of the woman, form it into what we call an embryo. But instead of now putting it in the woman, in the womb of the woman, the uterus, we are now putting it in the womb of another woman to nurture. Now, the big question is, the million-dollar question is it allowed in Islam? Scholars have said, majority of the scholars have said no. The ones that have managed to say yes are insisting that the person that will carry that pregnancy for that woman that is not able to carry it herself has to be a co-wife of the husband. Can you see? Let me come again. Most of the scholars have said surrogacy is not allowed. But the ones that have said surrogacy is allowed, they are saying that the only person, the only woman that can carry that baby for that infertile woman has to be the co-wife of her husband. So it has to be a woman that is legal to her husband. So that it can't be a woman outside wedlock. So that thing still goes back to the one I mentioned about egg donor. That if anybody wants to get egg donation, it has to be from the co-wife. So that means they are saying when it comes to surrogacy, when it comes to egg donation, it has to be in a polygynous setup. Okay, so that's the point. That's the consensus of the scholars on surrogacy, on egg donation. For sperm donation, there's no two way about it because a woman cannot have two husbands. You can't even use the sperm of your younger brother or your elder brother. Okay, so that's that question. Meanwhile, a lot of things are happening. I must not lie. A lot of things are happening behind the wall or behind what we see. There's so many sevens behind six. There's a lot that meets the eye that we cannot see. Because we've seen people doing all sorts. We have people that have turned egg donation into a business. A lady goes to donate her eggs in 10 different IVF centers. And we've seen women that collect up to 5 million for surrogates procedure and all that. The next question is endometriosis and fibroids. They are very, 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 very times 100 or very times 1 million. They are very different. Fibroids has to do with an abnormal growth in the womb of a woman. Just imagine something like a dough, a flour dough. You want to make bread, you now harden it. Maybe instead of putting a lot of butter, you don't put enough butter. The thing will be between firm and hard. It won't be soft. That's the way fibroids are. I would have loved to show you pictures and all that. So those fibroids now stay in the womb. Meanwhile, they have different locations in the womb. Some will go and stay inside where the baby is supposed to stay, in the lining of the womb, where the baby is supposed to implant and start growing. Those ones, we call them submucous. Those are the ones that are very notorious with excessive bleeding, that the woman will be saying she's bleeding all her life away. Okay? Now, those submucous ones can actually affect a woman from not getting pregnant. Because the way we explain to patients is that your baby is meant to be the landlord of your womb. Okay? The landlady or the landlord of that womb is your baby. But when your baby is not there, when the landlord is not around, the tenants will take over. So the fibroids are like unwanted tenants, tenants that they are just doing whatever they like. So when the tenants don't see the landlord occupying where he or she is supposed to occupy, the fibroids take over. That's how they will say somebody's fibroid was this small before, all of a sudden it became big, and their tummy is so big, and people are saying, Madam, Asokale and Fanny, they are telling you that you deliver safely, when you yourself know it is fibroid. Meanwhile, people get afraid. When they tell them they need to do surgery for fibroid, they run away. Okay, so fibroids are abnormal fibrous growths, okay, in the womb of a woman. Some can be inside the womb, some can be outside the womb, in the muscular lining of the womb. So some are up, some are inside, some are even down in the cervix, that will even prevent the sperm from going up. Okay, so they have different locations: subserous, submucous, intramuscular, and all that. Now, endometriosis. This one will be a little bit technical. Fibroids are so easy. They call fibroids Iju in Yoruba, Iju, Dore. Now, endometriosis, that one is the occurrence, okay, of the kind of tissue that is supposed to be inside the woman's womb, inside that inner lining that I talked about. We call it endometrium. If that thing is now outside the womb, that's what I can call endometriosis in lay terms. So the existence of endometrial tissue outside the lining of the womb. So that means each time, because that lining of the womb is the one that the woman menstruates every month, okay? Anytime a woman, the place gets ready to get a baby, when the baby doesn't come, it sheds away as menses, as in that place that has gotten ready. Now, when you now have that tissue that is supposed to be inside the womb, outside the womb, so each time that woman is menstruating, she's not only menstruating from inside of her womb, she's menstruating from outside of her womb. So all those exudates, all those seeping, secretions are all over in her abdomen, and they can cause inflammation, they can cause a lot of complications, and that's why they have a lot of pain when they are menstruating. Do you know that endometriosis is so bad that some of those tissues can get to the lungs of the woman? Some of them can get to the ovary. Some of them can get to her anus. So imagine when a woman is menstruating, she's menstruating from her lungs too. She's menstruating from her anus. She's menstruating from her umbilicus. So it makes that whole place matted up. That's what results in what we call frozen pelvis. And usually the eggs cannot move. The fallopian tubes cannot do like this. And so the woman will not get pregnant. So it's usually difficult for somebody that has endometriosis to get pregnant. One of the ways we do fertility treatment for them is IVF. So they are so different. You can Google some of these differences. There are two. Meanwhile, some women can have the two. And that's so sad. We have ladies that have both fibroids and endometriosis. And that's usually a very big one to tackle. All right. Those are the answers.
Thank you very much, Dr. Rabiu. Those are all the questions we got today.
Okay.
Jazakallah khair again for giving up your time to educate us on this really important issue. Could I ask you to make dua for us, please? Just to close.
Hello?
Hello? I said that.
Yeah?
You know what I said?
Okay.
I said, Jazakallah khair. Thank you very much. May Allah reward you. Thank you for coming out here today to discuss this very important topic with us. And I wanted to ask you to make dua for all of us before we close, please.
Okay. All right. Auzubillahi minash shaitanir rajim. Bismillahir rahmanir rahim. We thank Allah subhanahu wa ta'ala for making us Muslims. We beseech him in his infinite rahmah, let us die in the state of Islam. We Allah, we all have up our mouth to say, Allah, please grant us this, grant us that. I pray that Allah grants us our desires. May He give all the trying to conceive. We call them TTCs. We pray that Allah gives them the fruit of the womb. We pray that Allah gives them children that will be the apple of their eyes, that will be the joy of the family and the joy of humanity at large. I pray that Allah gives us all the strength to accept the trials Allah has given us, and Allah gives us the strength to be able to withstand the pressure. I know it's not easy for a lot of people, but when we put our trust in Allah, may Allah continue to sort us out in the best way. We should continue to put our trust in Him, because all these things, what Allah just needs to do is to say, kun fayakun, be and it shall be. So this day, I pray that Allah continue to preserve all of us upon goodness. May He forgive us our sins. I pray that He forgives us of all the things that we've said that are wrong, that we don't know. May He blot out our excesses, forgive us our iniquities, and overlook our shortcomings. May He protect us. May He give us good health. May He give us total shifa. These and many more we pray. We pray that Allah continues to guide us till the end of time. Subhanaka Allahumma wa bihamdika wa nashhadu an la ilaha illa anta wa nastaghfiruka wa natubu ilayk. Subhana rabbika rabbil izzati amma yasifun. Wassalamu alaykum.
Ameen. Thank you very much. Ameen. And may Allah accept all your du'as too. Thank you so much.
Ameen.
So that's it for today. Thank you for joining us. And please join us again, same time next week, Sunday, inshallah. Keep an eye out on our social media platforms for more information on Sunday's event. Assalamu alaikum.
Alaikum salam wa rahmatullahi wa barakatuh.
You can end meeting. Zainab.